Hello, I'm Gralnek. I'm the Senior Associate Editor for Gastrointestinal Endoscopy, and I'm joined today by Dr. Christopher Thompson, who is the Director of Therapeutic Endoscopy at the Brigham and Women's Hospital in Boston, part of Harvard Medical School. Welcome.
Thank you.
Nice to have you here, Dr. Thompson. We're going to be talking about his recently published paper in Gastrointestinal Endoscopy, and this is a long title, so I'm going to actually read this. Endoscopic sclerotherapy for the treatment of weight regain after Roux-en-Y bypass, outcomes, complications, and predictors of response in 575 procedures. It's a mouthful. But very, very interesting study, and you're to be congratulated on its publication. So can you tell our viewers a little bit about the issue of Roux-en-Y and weight regain and how we may be using endoscopic therapies to treat that?
Certainly. Well, weight regain after gastric bypass is actually a very common phenomenon. Many patients have been struggling with weight their entire life. They then have surgery, and they do well for a few years, hit a nadir weight, and then gradually start regaining their weight. Traditional approaches to deal with this certainly are dietary counseling and various weight loss programs, and many patients did go on to various surgical interventions, revisional procedures. So the problem with those procedures are that they carry significant morbidity and a mortality rate that is twice that of the original surgery. So endoscopic approaches are very interesting and certainly would carry less morbidity and could be helpful to these patients. In particular, several suturing devices have been used. The problem with those in the past are that they've been relatively expensive and in some cases hard to get a hold of, although we hope that's changing in the near future. But sodium moreuate was something that was very accessible. It's in pretty much everyone's endo unit, and it can be used to simply be injected submucosally around the gastrojejunal anastomosis, and with time and repeated injections you can scar down that anastomosis, making it tighter. And the theory is that the tighter the anastomosis, the better satiety patients will have, and that will then lead to weight loss.
So these were there's a retrospective analysis of prospectively collected data in a cohort of over 200 subjects.
Yes, over 200 subjects.
Over about a 3-year period.
Correct.
Okay. Can you tell us a little bit about how many sessions of sclerotherapy they went through and how much you were injecting?
Certainly. So patients either underwent 1, 2, or 3 sessions of injections, and they were typically just over 3 months apart if they underwent more than 1 session. And at each session, roughly 16 cc's were injected of the sodium moreuate.
Okay, and then you just followed what happened with their weight gain or weight loss, or whether it stabilized over time at 6 and 12 months afterwards.
That's correct.
I'm going to have you explain to our viewers what your ultimate findings were, but I have a couple of questions. So sodium moreuate, at least in my use of it in the distant past with variceal bleeding, it can cause ulcerations. What was the complication rate, and did you have problems with subsequent ulcerations and bleeding in these patients?
Certainly. So it was less than we thought it would be. The bleeding rate was only 2.4%, and it was more common for people to have nausea and abdominal pain immediately after the procedure. Mm-hmm. That occurred in over a third of patients. However, within a couple of hours, they felt fine and were able to be discharged. Only a few patients ended up being admitted for pain, and they were discharged the subsequent day.
Did you routinely put these patients on post-injection PPIs?
I didn't. I did use scopolamine patches to help with the nausea, and we would also send them home with a viscous lidocaine solution.
Okay. Has anybody looked at other sclerosing agents, alcohol, diluted alcohol, ethanolamine, polydocanol?
There's certainly a lot of literature describing their use in varices. However, for injection for outlet reduction, nothing's been published. In other countries, there are reports, non-English literature of other substances being injected. However, ethanolamine and some of the others have led to, I think, even worse pain and higher complication rates. So the study's not been repeated in the U.S.
Okay. So what did you find at 6 and 12 months in this cohort?
Certainly. So at 6 months, we had 92% weight stabilization, which was fantastic. So these people all had lost weight, hit their nadir weight, and then were all gaining, actively gaining, not plateaued. To be included, they had to be actively gaining at the time we started the injections. And then we followed them, and at the time of the last injection, we'd follow out 6 months or 12 months. And at 6 months, 92% had stabilized. Okay, so that was very encouraging. And at 12 months, over 70% still had stabilized.
Okay, so you viewed this as a positive endpoints in these individuals.
Yes.
So what are the next steps? Are you considering doing any type of a randomized trial or?
Absolutely, yeah, we're excited about that. So this is one procedure where you can certainly do a nice sham comparison.
Yeah.
So it's a quick upper endoscopy. The procedure takes 10 minutes, 15 minutes. So it's not terribly difficult to do a sham, and that's what we're planning right now.
Okay, well, I hope to be sitting with you here sometime in the future discussing that, the results of that future study. Any take-home messages at this point for our viewers who are out in practice? And we run into these patients more and more, a lot. They're referred to us after surgery and they're starting to gain weight. Would this be something that you would recommend at this point for use in practice?
Certainly. So although sodium morrieate is not FDA approved for the specific indication, I think there's building evidence out there. There's more than just our publication. There are a handful of other publications now also that show this as an effective therapy to help these people with weight regain. So I think that as long as the patients have been in a good diet program, they've had a good attempt at losing weight by non-interventional means, that it's certainly worth considering.
Okay. Well, Dr. Thompson, thank you for being here this morning. Congratulations on this publication, and thank you to all our viewers.